You know, we love our dogs, but sometimes it's tough to tell when something's off, right?
Yeah, they can't exactly say, hey, this hurts.
Exactly. So, in today's deep dive, we're tackling a topic that's close to all our hearts. Keeping our furry friends happy and mobile with some insights into canine orthopedic health. We're going to equip you to spot those subtle signs you might be missing.
I love it. It's like becoming your dog's own personal health detective.
Precisely. And we're lucky to be drawing insights from a true leader in the field. Dr. David Dycus, a renowned expert in canine orthopedics.
He's got years of experience, and he's sharing some eye-opening advice that can really change how we approach our dog's musculoskeletal health.
One of the biggest takeaways from Dr. Dycus is that so many owners, even vets sometimes, mistake those early signs of orthopedic issues for just regular stiffness, like, oh, he's just getting older kind of thing.
Especially during a vet visit, right? Those
Yeah.
pups are excited, maybe a little nervous, adrenaline's pumping.
Totally. They might not show lameness as obviously as they would at home.
Dr. Dycus is really big on observing those subtle cues, because even if your dog isn't limping dramatically, those little signs can reveal a lot.
Like what? What should we be watching for?
He says things like lip licking, changes in their panting,
Oh, interesting. I wouldn't have thought of that.
yeah, or even just turning their head to look back at their side more often than usual. It's like their way of saying something feels off.
It's like their own secret language, and we've got to learn to speak it. So once we start paying attention, what's next?
Well, Dr. Dycus has this fantastic 4-minute orthopedic exam he recommends every owner learn.
Okay, 4 minutes. I like the sound of that. Is it complicated?
Not at all. It starts with simply observing your dog's movement. Watch them walk towards you, away from you, and from the side.
Ah, so you get a full picture of how they're moving.
Exactly. And here's a cool tip. He suggests recording your dog's movement, maybe even using the slow motion feature on your phone. Sometimes those subtle hitches in their gait are easier to catch that way.
That's a great idea. It's like being your own dog detective.
Exactly. And after you've observed their movement, it's time to get a little more hands-on.
Hands-on, like actually touching them.
Yep. Dr. Dycus recommends carefully feeling each paw, even between their toes. You know, we love those toe beans, checking for any swelling, heat, or if they seem tender.
Okay, so we're checking those paws thoroughly. What about their joints?
Joints are key too. Now, of course, if you're ever unsure, your vet can guide you, but gently feeling their joints can reveal a lot. You're listening for any clicking or grinding. It's called crepitus, or feeling for pain, stiffness, or limited range of motion when you move the joint.
So if their knees sound like Rice Krispies, that's not a good thing.
Probably not. And there are some specific tests Dr. Dycus talks about for certain conditions, like if a dog's wrist bends too far back. That's called carpal hyperextension. Or that dreaded ACL tear, which can really sideline an active dog.
Oh, don't even get me started on ACL tears. My dog's been there, done that. Not fun.
They're tough.
Mm-hmm.
So say you notice your dog is favoring a leg. Dr. Dycus helps us figure out if it's the front or back leg that's bothering them. Let's start with elbows.
Okay, elbows. What are some telltale signs there?
Often, the most obvious sign is going to be reduced motion. But Dr. Dycus says to also pay attention to whether they seem to have more pain when you straighten their leg or when you bend it.
So pain when extending versus pain when flexing. Got it.
Right. If they resist straightening their leg, it could be something called an ununited anconial process, UAP for short. It's basically a little piece of bone in the elbow that hasn't fused properly.
Okay. And what about pain when bending the leg?
That might point to problems within the elbow joint itself. One possibility is medial compartment disease, where the inner part of the joint is affected.
So many things to watch out for. It makes you appreciate how complex their joints are.
It really does. And we can't forget about the biceps muscle.
Oh, right. Their biceps play a role in elbow movement too, don't they?
Exactly. It actually crosses over the elbow joint, so pain or any spasm in that bicep can be a big red flag.
It's like piecing together a puzzle, isn't it? You've got to look at all the pieces.
You got it. And speaking of puzzles, the shoulder is another area where those subtle signs can be easily missed.
Oh, shoulders are tricky. What should we be looking for there?
One thing is, if they have trouble fully straightening their leg, like they can't quite extend it all the way.
Limited extension. Got it.
Right. That could indicate something called osteochondritis dissecans, or OCD.
OCD, like the human condition.
It sounds scary, but it's actually a different kind of OCD. This one's a cartilage problem in the shoulder joint.
Ah, okay. That makes more sense. So limited extension could mean OCD. What else?
If they show pain when you move their leg outward, away from their body, that's called abduction, That might mean they have medial shoulder syndrome, which is another common issue.
Okay, so pain on abduction could equal medial shoulder syndrome. Got it.
And of course, if they're tender when you touch their shoulder muscles, or if they struggle with something called the biceps stretch test, those are also things to tell your vet. Dr. Dycus describes how to do that test.
So much to remember. But it's incredible how much we can learn just by observing our dogs closely.
It's true. And while we're focusing on orthopedic problems, it's important to remember those symptoms can sometimes be caused by neurological issues or even tumors.
So if you're seeing any of these signs at home, a trip to the vet is definitely in order. Don't try to diagnose this at home.
Exactly. Let's leave that to the professionals.
We've covered a lot about recognizing potential problems, but we've just scratched the surface. Coming up, we're going to dive deeper into specific shoulder conditions that Dr. Dycus says often get misdiagnosed.
Because soft tissue injury, well, that's just way too broad of a term. We need to unpack that.
So last time we were talking about becoming doggy detectives, learning to spot those subtle signs of lameness.
Because sometimes our pups try to be tough and hide their pain.
Exactly. And we talked about how important it is to get a proper diagnosis from your vet if you notice anything unusual.
Absolutely. Don't just brush it off as, oh, he's just getting old.
So true. And speaking of diagnoses, today we're diving into some specific shoulder conditions that often get misdiagnosed.
Right. Dr. Dycus says vets often use the term soft tissue injury as kind of a catch-all.
And it makes sense, right? Soft tissues, those muscles and tendons, they're involved in so many shoulder issues.
They are. But Dr. Dycus emphasizes that just calling everything a soft tissue injury can be a problem.
How so?
Because different soft tissue injuries need different treatment approaches.
So just like you wouldn't treat a sprained ankle the same way you treat a torn ligament, you need to be specific with shoulder problems too.
Exactly. He highlights 3 conditions that often get lumped together: supraspinatus tendinopathy, biceps tendinopathy, and medial shoulder syndrome.
Okay, those are some serious tongue twisters. But let's break them down. What exactly are tendinopathies?
Tendinopathies are basically overuse injuries. It's when a tendon, the tissue that connects muscle to bone, gets irritated and inflamed.
And the supraspinatus and biceps, those are both muscles in the shoulder, right?
You got it. The supraspinatus helps extend the shoulder, so think about when your dog pushes off with their paw to jump or run.
So like an explosive burst of energy.
Exactly. And the biceps muscle helps flex the elbow.
So tendinopathies in those muscles, they're common in athletic dogs.
Especially what Dr. Dycus calls weekend warriors. Those dogs who are usually couch potatoes, but then go all out at the park on Saturday.
Oh no, I can totally picture it. So all that sudden activity, that can put a lot of stress on those tendons.
Right. And over time, those repeated forceful movements can cause tiny tears in the tendon fibers.
Ouch, those poor tendons.
And here's the tricky part. Regular x-rays often don't show these micro tears, at least not in the early stages.
Really? So how do you diagnose a tendinopathy if x-rays aren't helpful?
Dr. Dycus says you need more specialized imaging, like an MRI or musculoskeletal ultrasound. Those can give you a clearer picture of what's going on in the tendon.
So it's like these advanced imaging techniques are like superpowers, letting us see those microscopic injuries. That's amazing. So once you know it's a tendinopathy, is surgery the next step?
Not necessarily. Dr. Dycus is a big believer in rehabilitation, especially for these overuse injuries.
Rehab, like physical therapy, but for dogs.
You got it. It's about restoring those proper mechanics, strengthening those muscles and tendons the right way. He says that, along with rest and maybe some pain medication, rehab can be incredibly effective for tendinopathies.
So it's not just about masking the pain, it's about addressing the root cause and helping those tendons heal properly.
Exactly.
Yeah.
And that brings us to our next shoulder mystery: medial shoulder syndrome. This one can be sneaky.
Sneaky how?
Well, dogs with medial shoulder syndrome might not even have a consistently obvious limp. You might just notice they subtly favor one side, especially during certain movements.
So it's like they're compensating somehow.
Right. And it's often misdiagnosed, even in very athletic dogs.
Is this like a doggy version of a rotator cuff injury?
That's a great analogy. We're still learning about the exact mechanics of medial shoulder syndrome, but it seems to involve a whole bunch of structures on the inner side of the shoulder.
Like ligaments, tendons, the joint capsule. It sounds complicated.
It is complex. Dr. Dycus says it's important to do a very thorough exam. One thing he checks for is pain when you extend the shoulder while also moving it away from the body.
So extending and abducting at the same time.
Exactly. He also uses a special tool called a goniometer to measure the angle of abduction.
A goniometer.
Yeah, it's like a protractor, but for joints. Dogs with medial shoulder syndrome often have a larger than normal abduction angle, meaning their leg can move further out to the side.
Fascinating. So when it comes to treating medial shoulder syndrome, is it a similar approach to tendinopathies with rehab being a key player?
Rehab is definitely important, but there's some debate in veterinary medicine about whether surgery is always necessary. Some vets recommend it right away, but Dr. Dycus likes to try a more conservative approach first, especially if it's not a super severe case.
So start with rest, maybe some injections to reduce inflammation, and of course, a good rehab plan.
You got it. He only considers surgery if the dog isn't improving with those other treatments.
It seems like Dr. Dycus is all about exhausting those non-surgical options first.
I like that approach. It's amazing how much progress we can make when we really understand these conditions, right? And speaking of conditions that require a deeper understanding, let's talk about a big one. Osteoarthritis. It's a word that can make any dog owner nervous.
It's definitely a common concern, especially as our dogs get older.
Yeah, we tend to think of osteoarthritis, or OA as it's often called, as just a normal part of aging. But what if it's not always so straightforward?
That's a key point that Dr. Dycus really emphasizes. He wants us to ditch that idea that OA is just an inevitable part of getting old.
So what's the real story then? What causes OA if it's not just age?
Well, age can be a factor, of course, but OA is often a consequence of something else, like those previous injuries we were talking about, or even developmental issues that start early on. So those things can come back to bite you, so to speak, even years later.
Exactly. And that's why catching OA early is so crucial.
You're right. But how do you do that? We talked about how standard x-rays don't always show those early signs of tendinopathy. Is it the same with OA?
It can be tricky.
Mm-hmm.
X-rays can definitely show those bony changes of advanced OA, but in the early stages, they might look totally normal. That's why Dr. Dycus loves something called COAST.
COAST.
Yeah, it stands for Canine Osteoarthritis Staging Tool.
Okay, so it helps figure out how far along the OA is.
Exactly. But it's more than just looking at x-rays. COAST takes a much more comprehensive approach, looking at things like how much pain the dog is in, their posture, how they move.
So it's like taking all the clues into account, not just one piece of the puzzle.
Exactly. It gives vets a much clearer picture of the dog's overall joint health.
That makes sense. So once you have that COAST assessment, what happens then?
Well, it helps determine the stage of OA, which is crucial for guiding treatment. And here's where it gets really interesting. Dr. Dycus talks about identifying dogs who are preclinical.
Preclinical. What does that mean?
It means they might be at risk for developing OA even before they show any obvious signs.
Wow, so they don't even have symptoms yet.
Not necessarily, but maybe there's some stiffness after they've been lying down for a while, or they're a little less enthusiastic about jumping up on the couch. Subtle things that owners might not even think twice about, but that could be early red flags.
That's incredible. So if you can identify those dogs early, even before the OA really takes hold, what can you do?
That's where the real power of proactive care comes in. Dr. Dycus talks about a two-pronged approach to OA management.
Two-pronged. Tell me more.
So the first prong is baseline management. This is for every dog with OA and really every dog in general, especially as they age. It's about setting them up for success, supporting joint health from the get-go.
Okay, so what does that involve?
It's those things we always talk about. Joint supplements, omega-3 fatty acids.
Right, those are good for reducing inflammation, aren't they?
Exactly. And then there's weight management.
Because those extra pounds, they put a lot of stress on those joints.
Exactly. And then the big one, exercise.
Wait, exercise. But doesn't exercise make OA worse?
That's a common misconception. Dr. Dycus says controlled, appropriate exercise is absolutely crucial for dogs with OA, even senior dogs.
So it's not about letting them run wild, but more like keeping those joints moving.
You got it. He recommends at least 2 20-minute leash walks every day, rain or shine.
Wow, that's a good reminder for all of us, even those of us without dogs.
It is. Exercise helps maintain muscle mass, which is so important for supporting those joints.
Makes sense. But what about when those inevitable flare-ups happen, even with the best baseline management? What do you do then?
That's where the second prong comes in. Flare-up management. When those painful episodes hit, pain relief is obviously the first priority.
So medications like NSAIDs.
They can be really helpful, and sometimes Dr. Dycus will recommend injecting medication directly into the affected joint.
To target the inflammation right at the source.
Exactly. There are different types of injections depending on the specifics of the case. And of course, rehab therapy is still a key player during a flare-up.
to help manage pain, improve mobility, and strengthen those muscles.
Precisely. It really is a team effort, involving owners, vets, and often rehab therapists as well. But when we all work together and we stay proactive, we can make a huge difference in the lives of dogs with OA.
That's a powerful message. It's not about accepting OA as a death sentence. It's about understanding it, managing it, and helping our dogs live their best lives.
Absolutely.
We've covered so much in this deep dive, from recognizing those subtle signs of lameness to specific shoulder conditions and the importance of a proactive approach to osteoarthritis. If there's one key takeaway, it's this. You are your dog's best advocate.
Couldn't agree more.
You know your dog best, you see them every day. So if you notice any changes in their mobility, no matter how small, don't hesitate to talk to your veterinarian. Early intervention can make all the difference. And don't be afraid to ask questions. The more you know, the better equipped you'll be to advocate for your furry friend's health and well-being.
I love it. Knowledge is power when it comes to keeping our canine companions happy and healthy.
Absolutely. And on that note, we'll wrap up today's deep dive. Thanks for joining us, and we'll see you next time for another fascinating exploration into the world of canine health.